In 1965, Professor Arthur Clarke was appointed Foundation Professor of the brand new Monash University Department of Paediatrics. Professor Clarke found his calling in refreshing the discipline, bringing a strong humanist ethos to the care of children.
Arthur was a pioneer in child-centred care and an innovator. He very much promoted child-centred care, putting the child at the centre of the medical care, both not just the child but the family, and through various innovations really transformed the way in which paediatrics was conducted, not just in Australia but around the world.
Professor Clarke also possessed a firm belief in the benefits that collaboration could bring to paediatrics. Assembling a team of specialists, he identified the Queen Victoria Hospital, at the time one of only 3 in the world founded, managed and staffed by women, as the place to begin the new department's journey. It was here that our first cohort of 32 undergraduate students undertook a 10-week course on the normal development and common illnesses of children. Despite years of financial hardship, Monash Paediatrics went on to produce pioneering research in neonatal breathing, started a newborn intensive care unit with Professor Victor Yu as the head, and founded the Centre for Early Human Development in 1978. By the 1990s, the Queen Victoria Hospital had become the Monash Medical Centre, offering a training program, theatre experience, and strengthened research capabilities. And after nearly 30 years at the helm, Professor Clarke stepped down, knowing his successors would keep the vision of a collaborative and inclusive Monash Paediatrics alive. And in 2017, Professor Clarke's long-held dream finally became a reality, with the opening of the Monash Children's Hospital, a state-of-the-art 230-bed facility, including a dedicated Monash Paediatric space. Today, Monash Paediatrics is embedded within the hospital, creating a seamless connection between research, education and care, training the next generation of paediatric clinicians and researchers to ensure compassionate, evidence-based care remains the standard for years to come.
The Department of Paediatrics is immediately linked to the clinical service and the institutes and other research opportunities on this one campus. Through that, we've created discovery to clinical care improvement pipelines that bring important changes much faster than if we were not working in this environment.
This landscape, this site is so rich with the support and infrastructure which is present. Hardly any institutions which have the infrastructure like Monash has, where you have cutting-edge research platforms on site here at the Monash Children's campus, but also the main university campus, which is just a walk away, which makes it a really fertile ground to be able to do research which no one else can do in Australia.
Our world-renowned research from basic lab discovery through to clinical and population health covers the age spectrum from conception to adolescence and beyond. Every child remains the ethos behind all our initiatives, from surgery to sleep, low income to high tech, intensive care to community care.
Every child means that whatever we do, we have the child as the focus. What that means is that if I'm doing clinical medicine, I'm trying to improve the well-being of that child. If you're doing research, we want to be inclusive for every child. And I have a very strong feeling about that. I want every child who is eligible for my research studies to be included. Irrespective of where they live, what background they come from, what language they speak, I want every child to be inclusive.
The proven rewards of collaboration, a founding principle of our department, continue to drive our partnerships today.
The department has just grown enormously. It still is the foundation of research and education, which supports the Monash Children's Hospital. Through key appointments, we've expanded research in a few key disciplines, which include sleep medicine, the simulation centre, immunology, gastroenterology, neonatology and neurology. And it's really gone to another level. It's just organic growth in these disciplines and in the research and education that supports the Monash Children's Hospital and allows it to attract the best doctors and also stay at the cutting edge of clinical care.
And of course, Monash Paediatrics continues to focus on education with more than 500 medical students at locations across Melbourne, Victoria and Malaysia. A key pillar of our education model is simulation, the Monash Children's Hospital Simulation Centre, Another collaboration between the department and the hospital offers world-leading paediatric simulation facilities, including a fully functioning operating theatre.
Simulation is one of those amazing things that where actually clinicians can actually gain essential skills to actually improve the care that they provide before getting to a patient. Clinicians come here, whether it's treating babies, whether it's treating children, whether it's from PICU, intensive care, or whether it's just from the emergency department. All different aspects of paediatric care are amenable to simulation to get really that core group of skills acquired before they treat patients. That's the strength of Monash. So we have the pleasure of working in a department that's part of a much bigger, innovative university that has so many different experts and so many people willing to actually help improve care by harnessing new technology that may not actually be used for that setting to improve care.
So, where to from here for Monash Paediatrics? We will continue to expand and embed research and education through the department, hospital, and our research institute partners, ensuring that every specialty is involved and active, from sleep to surgery, neurology to nutrition. We'll build on our international reputation by strengthening our 3 key pillars: research, education, and child-centered care. Continuing to attract the brightest minds to study and work with us, we continue to forge new collaborations nationally and globally, just as Professor Clark envisioned 60 years ago.
It's a very exciting time going forward for children and families. The opportunity to work in this intersectoral way with people that are just experts in data and information technology and AI is going to transform healthcare faster in the next 60 years than it's been transformed in the last 60. Monash Children's, in the collective sense of the Department of Paediatrics, Monash Children's Hospital, and our colleagues that are working in laboratories at the Hudson and other institutes, are well positioned to really support the advancement and lead change in the sector.
6 decades of research, education, collaboration, and service, and so many more to come. There's never been a better time to be part of it.